In this video, I'm going to talk about mallet finger, also known as drop finger or drooping finger, because it causes the end joint of the finger, or indeed the thumb, to droop like this. So I'm going to discuss what the condition is, what causes it, and how it's treated. I'm Stephen Bunting. I'm a specialist MSK physiotherapist and sonographer based in the UK. Welcome to my channel, where I discuss the common MSK conditions that affect everyday people and the evidence-based treatments that can help. Well, in essence, mallet injury is an injury where the extensor tendon that lifts and straightens the finger becomes detached from the end finger bone, so it no longer works properly. Normally, the extensor tendon attaches to the end bone of the finger, called the distal phalanx, and when the tendon pulls, the end joint of the finger, called the DIP joint, straightens like this. In a mallet finger injury, the tendon tears off from its attachment point, so now, when the tendon pulls, it's attached to nothing, and so the end finger joint won't straighten properly. The end of the finger now hangs down loosely like this. You can still bend it normally because the flexor tendon is working fine, and so you can still grip and use your finger fairly normally, but it just won't straighten fully anymore and will hang loosely in the classic drop finger position when at rest. And it can also happen to the thumb. So when I talk about the finger throughout this video, well, if you've got a mallet thumb, then the information still applies to you, just swap finger for thumb. In the vast majority of cases, the condition is caused by an injury, usually a stubbed finger injury, where the end of the finger hits something aggressively and is forced quickly into a bent position. This causes the tendon to tear off from its attachment point. The common type of injuries we see are ball catching injuries, where the catcher has just mistimed the catch and the ball has caught the end of the finger. In the UK, it's commonly seen in cricket, and in the US, it has the alternative name of baseball finger. Any activity that suddenly forces the end joint into a bent position can cause the problem. I've even seen it happen in a lady who was tucking in a bed sheet and just caught her finger on the mattress. After the injury, the initial symptom is pain and swelling to the fingertip, and it might bruise the following day on the nail side of the finger. It might also be quite sore to touch, but the main symptom is the drooped finger. You just won't be able to straighten the fingertip. You should be able to straighten the next joint down, as the tendon attaches to that joint, called the PIP joint, by another part called the central slip, and assuming that that's not damaged as well, you should be able to move the middle finger joint normally. And so it's diagnosed by having the classic stubbed finger history plus the drooping finger. If you go to a trauma centre, then you'll probably get an X-ray to rule out a fracture, and that will commonly find that a tiny flake of bone has pulled off the fingertip, something called an avulsion injury. This is because the tendon is so strong that it rarely snaps, so to speak. Instead, it usually pulls off the piece of bone that it's attached to, and this can be seen on X-ray as a small flake of bone near the fingertip. The other investigation that might be done is an ultrasound scan, as this can show the tendon and the position of its detached end. Well, the treatment depends on whether the injury is seen quickly enough or whether it's been left too late. This is because over time the unattached tendon stump will slowly retract up the finger, eventually getting to the point where it will no longer be able to heal itself. So if a mallet finger injury is seen and treated within a week or two, and preferably within a few days, then the scope for full recovery is very good. If the stump of the tendon is allowed to rest in a position near its original attachment point, then it will try to reattach itself. This can take at least 8 weeks and is achieved by wearing a mallet finger splint, which will keep the end of your joint fully straight. And the sooner you get one and start using it, the better chance you have of getting it to heal. Smokers and diabetics do have a reduced tendon healing capacity, so if this is you, then be extra vigilant when using the splint in order to give it every chance of healing. This is a mallet finger splint. It goes on like this, and is kept in place either with a Velcro strap or with some tape. It keeps the end joint of the finger fully straight, but it does allow movement of the middle finger joint. Once it's on, the finger must now be kept in this position for the full 8 weeks. You can take the splint off to clean it and the finger, but you must keep the finger fully straight throughout this process and then put it back on straight afterwards. If you bend the joint, then you risk pulling the tendon back off the bone again while it's trying to heal, and you'll end up back at square one. The best way of keeping it straight while you clean the finger is to push the pad of your finger firmly down onto a table like this. Then slide the splint off, but keep the fingertip pressed down while you clean all around it. Then slide it back on and secure it again. You can do this every day to keep the finger clean, but you must keep the splint on and dry for the rest of the time. After 8 weeks, if you followed these instructions carefully, then it should have healed in the majority of cases. You can now take it off and see if you can move your finger. The joint will be stiff, but if you support the middle finger joint with your other hand and then try to wiggle the end joint, if there is any upwards movement, as in a straightening of the end finger joint, then great, the tendon is reattached. You can now start using your finger normally, but remember that it still might be a bit weak, so avoid sports or strenuous finger activities for at least another 8 weeks. It's also normal for the joint to be stiff and achy for a month or 2, but this should steadily improve. But if you take the splint off and the fingertip is still drooping and there is no straightening movement, then it might not have healed. Just to be sure though, support the joint underneath with your thumb and then try and keep the fingertip still while pushing down on the nail with your other hand. If the joint is still floppy, then it's not healed. But if you can resist the downwards movement, then it might have healed, but the joint is just stiff. Get checked out by your therapist or doctor just to be sure, as you need to be certain that it's reattached before you stop using the splint. Okay, so now let's discuss the options for a mallet finger that doesn't heal. Well, I mentioned before that the tendon stump will retract up the finger over time, and so there is a window of opportunity for it to be fixed surgically. If it's left too late, then the tendon will have retracted too far for the surgeon to find it and then pull it back down and pin it in place. And the problem is that even after 4 months, which is the time you might have splinted it for at this point, then it might be too late. You will need to see a hand surgeon quickly at this point to get an opinion. However, a non-healed mallet finger is usually not a big deal for most people. Yes, you can have a droopy finger that won't fully straighten, but it won't affect your gripping, and it usually won't affect your hand function in any way. It's often more of a cosmetic issue for some people, but really, unless you need to fully straighten the finger for a particular purpose, then it shouldn't be a problem for you. In fact, in the neutral position that most people adopt when resting, you would never know, because all the fingers tend to rest in a slightly bent position. And it's not usually painful. So if you are happy to leave it alone, then that's usually just fine. The other options are surgical. So as I mentioned before, there is a time window for repair. The sooner the better. So you might be asking, well, why don't they just repair all mallet fingers and not bother with the splint? Well, it's because the vast majority will heal just fine with the splint, and because surgery carries risk such as infection, nerve damage, chronic pain, etc., then you would be exposing the vast majority of people to unnecessary surgery and therefore unnecessary risk. And also because if it doesn't heal, then the consequences are fairly insignificant for most people. So as a result, surgical repair of a mallet finger injury shouldn't be needed in the majority of cases. But, of course, you would need to see a hand surgeon to determine if surgical repair is an option for you, and if it is, to discuss the risks and benefits in your individual case. The last thing I will mention is for that rare group of people who have a chronic but painful mallet finger that can't be repaired because the tendon has retracted too far. Well, for those people, the end joint, the DIP joint, can be surgically fused so it no longer moves. It's fused in a slightly bent position so that you can have a normal pinch grip. In fact, it's fused in pretty much the exact position that a drooping mallet finger will rest in naturally. So a fusion won't improve the function or cosmetic appearance of the finger, but it can help with pain if persistent joint pain is your main problem. So to reiterate, if you have a mallet finger injury, then the key thing to remember is that the vast majority will heal just fine. You just need to keep the end joint of the finger fully straight for about 8 weeks. You must not let it bend or it won't heal. And the easiest way to achieve this is by using a mallet finger splint. Okay, well that's about it. Good luck with your mallet finger. I hope you found the video helpful. Thanks very much for watching, and bye for now.